So comprehensive pain management and regenerative injection therapies are not a part of the core curriculum in naturopathic medical school or osteopathic medical school or your standard um, medical degree. That's something that if a doctor is going to do pain management and really specialize, especially using the more progressive techniques that like we do here, you really have to go after the training and you have to go after the certifications. And when you're looking for different solutions like that, it's there's so much to consider. In my own pain recovery journey, I have I drove 3.5 hours one time to see a physical therapist. That was it was worth 3.5 hours one way to have a 45-minute visit with her because the results were so profound. I used to fly halfway across the country to see a team of physical therapists when I was first really finding solutions that would help me recover from pain, and it gave so much quality of life back that I did everything I could to learn while I was there and take home things that I could do in between treatments. But I did visit that center a couple of times at the beginning, and it helped me start to get things under control. And as my education continued and I started getting exposed to even more modalities that can be used in a comprehensive pain management case, I not only got to go through recovery myself, but I was able to learn these amazing techniques, and I do that now in my practice. So some of the things that I lean on the most are my manual therapy skills. My husband and I both have studied in both light touch and deep touch therapies. My scope offers, I can do some manipulations, mobilizations, and chiropractics. I do have training there. And the one tool that I know I have and I can use anywhere is my hands, and I do a lot of that. So I put a lot of hands on to work with the soft tissues, the connective tissues in the joints. But the other, I pair that work with the injections that we do here. And the injections we do, there's like a whole talk on my website on regenerative injections, so you can learn a little bit more there. But the way that I got into this, I signed up for a course. We were going to be learning some of the bigger joints. The first joint I had done, I got both my knees done. And that was performed by a student who didn't have any experience. And for 2 weeks, my knees felt like they had a big toothache, and it was pretty painful. That's a normal response after these injections. And after that time period, I remember I squatted down and I couldn't even feel my knees. And I, at that moment, realized I really had never done that without pain. And I did work my body pretty hard as an athlete from a young age, and I didn't take care of myself in the ways that I now know to. But it was a really profound experience having my knees feel kind of brand new that way. And I was in my 30s at this time. So after that, I went on and I got more and more certifications to do things like add ozone to the injections, to do prolotherapy in different areas. I was trained in neural prolo, mesotherapy, trigger point therapies. I do all kinds of injections, and it's really rewarding to help solve pain in without just using medications to kind of stick a band-aid on there and try and cover it up, which we all know doesn't work great. And even people that go to really good pain management centers often are still experiencing a poor quality of life and aren't really regenerating in any way. So there's another talk on my website about oxygen utilization and using some of the other therapies that can help drive healing and regenerative medicine. But the idea of comprehensive pain management to bring together things like everything, from acupuncture and cupping to manual therapy and manipulations. I do a lot of foam rolling with people. I'll get down on the floor and just teach someone how to foam roll the right areas to keep the hips and the back free, which makes knees and ankles a lot happier. Right now, I'm repairing a couple of shoulders that the surgeons won't even touch. The gentleman I'm working with doesn't have another option. He has no surgical option. He has very limited active range of motion, or did before we started. and has responded very well to platelet therapies and prolotherapies in the shoulders. And to see someone that really didn't have any other options come through care and after just 2 injections be 50% better is a pretty amazing thing. So that's what we do. That's what comprehensive pain management is about. It's about really solving the problem and getting to the other side of the pain.